This is a demonstration for practical 2 GIT. The first slide that you will look into, the first image that you will look into is leukoplakia. So basically you can actually see the lesion in the tongue here, right? And the tongue, the lesion is wide, elevated, and it has poor defined borders. Next is oral cancer or tongue CA. So this is actually a lesion in the tongue. You can see that the lesion is protruding and has ulceration in the center. It is actually poor defined, and you can see in the center the ulcer base is actually very necrotic with areas of hemorrhage and necrosis. Next is Barrett esophagus. So this is the esophagus, and this is the lower part of esophagus. So in this area you can see the whole area become salmon pink area. So that's the area of Barrett esophagus. Next is esophagus adenocarcinoma. So you can see an ulcerating lesion there, right, near to the lower part of the esophagus, and it is actually elevated, and you can see the margin is rolling, and in the base is actually basically necrotic and dirty with areas of hemorrhage and necrosis. Next is gastric esophagus squamous cell carcinoma. So the location is actually at the middle part of the esophagus, right? And you can see it is actually again an ulcerating tumor with elevated and rolling edge, right, with dirty and necrotic base with area of hemorrhage and necrosis in the base. Next one is gastric adenocarcinoma. There's a lot of feature of adenocarcinoma, but the one I'm showing here is actually a fungating lesion. But you can also see there's actually ulceration here at the upper part of the fungating lesion. The edge is basically what we call as rolling or elevated, and again the base is dirty and necrotic with area of hemorrhage and necrosis. Next is polyposis coli. This is actually surface of a colon, right? But basically you don't see any hostration anymore. It is consists of multiple. It's not even multiple. It's more than 100 polyp on the surface of the mucosa. The next one is colon adenocarcinoma or colon carcinoma. Again, this is also a tumor, right? An ulcerating tumor, and you can see there is actually a base which is necrotic and dirty with areas of hemorrhage and necrosis. And again, the margin is actually what we call as elevated or rolling. Next is gallstone. So you can actually see this is actually a gallbladder which is distended by multiple stones inside the pouch of the gallbladder, and the color is yellowish. And next one is acute cholecystitis. So you can actually see that the gallbladder is enlarged, it is inflamed, reddish in color, right? And you can actually see the yellowish thing there. That's basically the bile at the mucosa. And next, the last one is the chronic cholecystitis. As labeled there, you can actually see that the gallbladder is very thickened and fibrotic, and sometimes you can see hemorrhage in the mucosa as well. Okay. For virtual microscopy, the first slide is on leukoplakia. So when you open the slide, it will appear like this. Just focus on this area, because in this area you can actually see there's actually an ulceration of the squamous epithelium, but the squamous epithelium cells is basically dysplastic. So all 5 features of malignancy you can find here: hyperchromatism, mitosis, and pleomorphism there. Okay. The next one is oral squamous cell carcinoma. So this is actually the area that you need to focus on, because when you focus, you can see all these are malignant squamous tumor, squamous cells. Okay, and this is the keratin pearl. So basically all the cells has 5 features of malignancy, as in pleomorphism, hyperchromatism, and high NC ratio. Next is Barrett esophagus. So you will open this slide, just focus on this area. Okay, and you can actually see the changes from squamous into glandular epithelium, and most importantly, in the epithelium you can see presence of goblet cells. So that's palate esophagus. Next is esophagus adenocarcinoma. So again, in this slide, please click this button, okay, to enlarge it. And when you enlarge it, you can actually see all these malignant glands at the upper part of it, right? Okay, malignant glands, right? So this malignant glands all has all again the 5 features of malignancy. So this is esophagus adenocarcinoma. Esophagus adenocarcinoma again similar to squamous cell carcinoma. So when you open the slide, you can actually see there's actually benign squamous epithelium and there's invasive squamous cancers, malignant squamous cell there, and it's in nests. Okay, all right, and it has all 5 features of malignancy, including the center. There's actually necrosis, and you can actually find there's few keratin pearls, small keratin pearls there and there. Okay. Next is gastric adenocarcinoma. So basically you can actually see this is the epithelium that has gone to ulceration, but at this part of this of the mucosa, you can see there's a lot of gland there, but the gland is very irregular, and this is what we call as malignant glands, and it has all the 5 features of malignancy again. Okay. Next is tubular adenoma. Basically this is actually a polyp, neoplastic polyp. This is actually a polyp. You can see it is actually a polypoidal architecture, and then you can see there's actually a stalk there. Right. Most importantly, it is composed of proliferation of glands, and these glands are dysplastic. Basically, you can see features of hyperchromatic nuclei and pleomorphism there and there. It's not yet invasive, but it is dysplastic. Next, we are going to look into gastric colon adenocarcinoma. So this slide, when you open, has a lot of annotation that you can actually look into and guide you. But if you look into this slide, you can actually see the benign and the malignant part. All right. And when you look into the malignant part, you can see it is composed of again malignant glands, and all 5 features of malignancy you can see in the cells, epithelial cells. And the last one is chronic cholecystitis. So this is actually a section of the gallbladder. When you open the slide, you can actually see these two wall of gallbladder. Most importantly, most obviously you can see this brownish material. This is actually what we call as the cholesterols that trap inside the bile that trap inside the wall of the gallbladder. But most importantly, apart from the infiltration by lymphocyte inside the stroma, you can actually see invagination of the mucosa inside the muscularis area, and this is what we call as Rotikansky-Ashkoff sinuses. That's all. Thank you.